the assistance of artificial intelligence, a new study has actually found that there's a significant number of Americans who are currently suffering from long COVID. Researchers at Mass General developing an AI-based tool. It examines large amounts of data to look for symptoms such as fatigue, chronic cough, heart problems, even that so-called brain fog that came with COVID-19. The AI tool then used to assist with the study, finding that about 23% of Americans suffer from some form of long COVID. With us right now, we've got Dr. Mena Mirhom to explain what exactly that is, how we can define it, and, if we can get rid of it. I mean, is there any telling if this is something that we have to live with forever?
Well, Marina, this is part of what's the first step here of figuring out how we can get rid of this is better understanding it. So previous data, we thought this was closer to 6.9% of folks who have long COVID, and now we've got this better tool to be able to assess and say all these unexplained symptoms. I've had over the past 3 years patients who come to me and say, I just don't feel like myself, and I've had studies, and I've had tests, and I've had this and that, and I don't know what's underneath this. Well, now we can say this is actually related back to long COVID, and one part is looking at the symptomatic approach, but another is seeing how these symptoms actually fit together. And that's one thing that we see in this study.
And when you say long COVID, the first thing I'm going to say is how long is long COVID?
I hear you, Joe. Yeah, because this already feels like COVID's been long for all of us, right? This is longer than we ever wanted it to be. And it really varies. What we see here in this data is for some folks, this is a matter of a few months to a year. For some folks, you can begin to have mild but lingering symptoms over actually a couple of years, and it can be pretty disruptive. Yeah, this is the unfortunate part that we've seen, and it's part of the reason that this study here is saying, hey, let's still be vigilant. Let's still be thinking about prevention of COVID to begin with, because it's not just this little mild flu that comes and goes, and hey, why do I really care about this anymore? We're so past 2020. It's like, well, we want to prevent these kind of lingering symptoms, so prevent infection to begin with.
Look, everybody knows their body probably the best, right? Is there one thing that these researchers have been able to find that people who suffer from long COVID all have, or is it a multitude of possibilities that could result in long COVID?
Well, this has been one of the highlights there is who is most susceptible that we see. This is folks under 50, women, and if you have some predisposing or other conditions that were making the COVID symptoms worse in the height of COVID, things like diabetes or uncontrolled hypertension, other areas where we know that the more healthy we are overall and the more our immune system is intact, the best that we can sort of have it. That prevents the severity of COVID, and that also makes long COVID a little bit less likely. So it's another incentive to say, am I maximizing my immunity? Am I maximizing my health overall? Because that's one thread that we see across the board for folks who struggle with long COVID.
Well, hopefully the next thing that they'll figure out is how to get rid of that long COVID, because I'm sure a lot of these symptoms are, they're not really like tangible per se. They're just that malaise feeling that you have. So, Dr. Mena, can we talk about this new study also that's referring to children and their usage of caffeine? It's startling because these numbers show that caffeine-related ER visits by middle school-aged children has almost doubled in just the last 5 years here. The rate also doubling for high school kids. What should parents know about the rise in caffeine? I mean, are they drinking coffee?
Yeah, where are they getting this caffeine from?
Or is it just your usual soda and other things?
Well, this is the thing, Marina. As a psychiatrist, I see these and I have discussed this with patients in the ER almost every day. The common things, it's not so much, what's in my pumpkin spice latte, but now there is a much broader category of places where children are getting caffeine. It is things like your energy drink. When I walk through this with a patient and say, oh, I have this soda every day, and I have this energy drink, and I have this amount of chocolate or sweets or cereal, so many areas in their diet is actually jam-packed with caffeine, and they may not realize it because it's not a bunch of espressos every morning. It is the usual diet that we've come accustomed to now that is heavy in sugars and heavy and fortified into, this is the Celsius drink, this is the diet soda. That's very, very common, and children are not thinking that this has as much caffeine, up to sometimes 300 milligrams, as they would expect.
Wow.
We need a caffeine czar. Donald Trump needs a caffeine czar. We need to find out who this caffeine czar is.
I nominate you, Joe.
In the political, I mean, not to get political, but that's the talk, right? Is about changing how we eat, changing especially how our children eat. Because to your point, if it's not just the caffeinated drinks, if it's the cereals, it's all the sugar that should really
caffeine is cereal?
Yes, sir.
Well, the sugar.
So this is what's also surprising, Joe, is that the places that we usually attribute to caffeine, we just think about coffee, tea, caffeinated beverages. We don't think about how things like cereal or chocolate or a lot of these other food groups. And then here's the other next step. When we think about tracking anxiety and a patient comes to me or a family comes and says, Doc, my 12-year-old has been having panic attacks. My child has been experiencing increased anxiety for so many reasons. The first question I ask is, let's take a look at your diet. What are we eating? What are we drinking throughout the day? Because that's the first place that can begin to be impacted, is how anxious and nervous and panicky that a child will feel.
All right, there's only water for us. We'll be
Right,
fine.
yeah. What is going on? I'm about to go check my kids.
No, I mean, it's a huge conversation that we need to be having, because to your point, we are seeing with social media, these kids are having more anxiety. Then you couple that with what they're eating, what they're drinking,
And what's in what they're eating.
It's a ticking time bomb for these children.
And the more we're aware of that, and the more we can teach them. This is the big takeaway I take with parents is you can give kids now choices of saying, well, now you want to feel better and you want to see what's trending on your social media, but here's how this can be empowering for you, because what you eat and what you drink determines how you feel as a young person.
Such an important
I'm about to turn
conversation.
into granola dad at home. You ever heard of granola dad?
Yeah.
Everything brown.
Granola sugar-free.
Yeah, sugar-free, everything brown, everything from the ground.
Dr. Mirhom, thank you so
Stuff
much
on the
for such a
outside of the
conversation we
grocery
should all be
store.
happening.
Appreciate you, Marina. Thank you.
Their children and ourselves too, as we look.
Thank you so much, Doctor.
Thank you.
The sugar. It's not good.